Well, good afternoon, everyone, and welcome to the COVID-19 update for Thursday, December the 10th. Before we begin, I want to wish all who celebrate the Festival of Lights a happy first night of Hanukkah. As with so many other religious and cultural traditions, in Judaism, this holiday season is a time for hope and for warmth and for giving. It's a holiday that celebrates a miracle, and it encourages sharing hope and faith with others, knowing that our candle will never dim when we protect our neighbors from being left in the dark. Those lessons ring true in these difficult times for people of every faith. And throughout this pandemic, I've been exceptionally moved by all the ways in which I've seen Illinoisans share the light wherever they can. And I'm very certain that we'll come out of this on the other side stronger for it. I'm very pleased to offer a warm welcome home to the 150 soldiers of the Illinois National Guard's 105th Chemical Company, who have spent the majority of the last year serving in the Middle East. Their normal work, which includes protecting our forces and, of course, the nation from chemical, biological, and nuclear threats, but in this pandemic, their jobs also have included COVID-19 decontamination work, and I am so grateful for all of their service, both overseas and here at home. As we fight through the devastating economic effects of COVID, I want to make sure that everybody knows that we have financial support available for small businesses that have suffered during this pandemic. Applications for our Illinois Small Business Assistance Program, the Business Interruption Grants, will close at 5 p.m. Tuesday, December the 15th. That's just 5 days away. Since we launched the BIG program in June, making $540 million available to small businesses, with $270 million reserved for child care businesses specifically, we've seen an enormous response, which speaks to the challenges that are faced by so many of our small businesses. For the $270 million devoted to all small businesses, to date, our Department of Commerce and Economic Opportunity has so far paid out more than $168 million to over 6,300 small businesses, spanning over 500 cities around the state of Illinois. More funding remains, and we expect to continue issuing grants through the end of the year until the full $270 million of allocation is exhausted. Special consideration is given to businesses in heavily impacted industries, businesses located in areas hard hit by the pandemic, especially those in downstate communities, businesses with annual revenues of $5 million or less, and businesses that have not received other forms of emergency assistance like PPP. The BIG program provides grants ranging from $5,000 to $150,000, with an average grant size to date of $25,000. Grant funds may be used toward operational expenses, including PPE, rent and utilities, payroll, and more. Really, any of the costs associated with keeping the businesses running, and which have been made all the more difficult because of the pandemic. If you own a small business, or you know someone who does, make sure that they take the time to submit an application if they qualify. DCEO and its outreach partners can provide technical assistance to walk you through the application process if you need it. For more information, visit illinois.gov/DCEO. And because communities, like businesses all across our state, continue to battle the economic impact of COVID-19, I want to remind folks that our local cure program supporting local governments is also ongoing. To date, nearly $147 million has been paid out or is already on its way for payment, supporting 688 cities, towns, counties, health departments, with funds to offset some of the enormous costs incurred during the COVID-19 emergency response. However, hundreds of local governments have yet to take steps they need to register for this program. And we encourage them to do so soon, so that together we can ensure that no federal dollars are left on the table and that every community has access to economic support. At the beginning of the week, I said that I was hopeful that some of the recent early improvement in our COVID leading indicators will continue. And I'm glad to say that we have yet to see a reversal in our progress that would dash that hope. Though again, we are not out of the Thanksgiving surge period yet. We unfortunately still have hundreds more Illinoisans in the hospital fighting COVID-19 than we did at our spring peak. But we're also hundreds below our overall pandemic record to date of November 25th. And remember, these are all on 7-day rolling average bases to account for single-day anomalies. All that said, I cannot overstate how preliminary this progress is. We are at a time of year when traditional gatherings are usually abundant, and because of the severity of this pandemic, it's really never been more important not to do so. So mask up, keep your distance, and plan smaller, more intimate holidays this year with members of your household. It's the best thing that we can do to show each other that we care during this unusual holiday season. Thank you, and with that, I'd like to turn it over to Dr. Ngozi Ezike.
Thank you, Governor, and good afternoon, everyone. We are learning more every day about vaccines for COVID-19, including information that will be coming out from the FDA about the emergency use authorization for the Pfizer vaccine, maybe momentarily. I know that there's concern about the COVID vaccine. As the public health leader for the state of Illinois, I want people to know that I will be getting the vaccine when it's my turn and when it's available and after approval by the FDA and recommendations by the Advisory Committee on Immunization Practices. I do trust in vaccines. I trust in the development and approval system that has been created in this country. And from what is known, the safety and the efficacy of the vaccine has been evaluated appropriately. As a physician, I would recommend that unless you have a direct medical contraindication, if it is approved by our FDA, that you get vaccinated. I encourage people to learn for themselves from medical research experts about the vaccine and be able to discern the myths from truths. There is a lot of misinformation, so please obtain credible medical research expert information as opposed to just social media myths that are going around. Only when people adjust their personal behaviors with the mask and the distancing and the avoidance of gatherings combined with the vaccination will we get to end this pandemic and get to our normal way of living. As the governor mentioned with the end-of-year parties, I urge you not to plan an end-of-year party or a holiday party in the large gatherings that we're used to, but start planning for the end-of-pandemic party for next year. Today, we are reporting 11,101 individuals who were newly diagnosed with COVID-19 for a total of 823,531 total individuals with COVID-19 in Illinois. Unfortunately, we also have report of 196 individuals who lost their battle with COVID, bringing the total number of individuals who have been lost to COVID in Illinois to 13,861. In the hospital overnight with COVID were 5,138 individuals, 1,081 patients were in the ICU, and 606 patients were on ventilators. In the last 24 hours, more than 114,000 tests have been reported for a total of almost 11.5 million tests. While it will take many months for the vaccine to be widely available, please see with me that the finish line is in sight. We've come very far. Let's keep going and let's get everybody to the end of this marathon and get back to normal altogether. Thank you.